I am Akilah Pascall. I'm a pediatrician. I'm currently working in the United States of America in Florida, where I'm now completing my pediatric residency. So far, we know that COVID-19 does infect everybody. However, what we do know is that most of the children who get COVID-19, it's usually mild or asymptomatic disease in that population. However, there is a small group of children who do develop severe disease and can even develop a really dangerous disease called multi-inflammatory syndrome in children. But again, this is rare. So most of the kids who do get COVID are usually have it mild or very asymptomatic. But we do have lots of cases, especially in South Florida, where the numbers are increasing rapidly every day. The number one concern is complacency and familiarity. So I think when this whole pandemic first started, everybody was extremely cautious. People would be cleaning their hands, they were washing their hands, everybody was very judicious about wearing their masks. But because it's been around, I mean, like anything with alarm fatigue, people are becoming numb to it. So the number one thing is to just always be on guard, to not let your guard down, don't fall into that realm of complacency and familiarity and take it for granted. The other thing is, I think a lot of people are seeing people who have the virus and they're mild and they're asymptomatic, and they're assuming that if I get the virus, it isn't going to be that bad. The reality is you don't know how it is the virus is going to affect you. And not only that, you don't know how the virus is going to affect the people that you love. So you definitely want to be cautious. With regards to opening up, I think people just really need to be cautious. Even though things are open, doesn't necessarily mean that you need to go. If it is that you see that there are crowds, so for example, the beach opening up, yes, the beach can be safe if no one else is on the beach and it's just you. But if it is that you're looking at images and you're seeing the beaches are crowded with people, you definitely want to avoid that and try to go to places where you can maintain social distance and be safe with your family. With regards to going out to restaurants and stuff, again, you want to make sure that there's safety. And then also look at your state and your region. So for example, in Florida, the numbers are going up exponentially every single day. So I mean, even though things are open, it probably isn't wise to go outside right now. So look at things, trend the numbers, and see if it's really worth the risk to go out to have some sort of social activities. With regards to the hospital, I think the thing that we've been hammering with emails every day is just not to forget that the virus is there. Even as health professionals ourselves, because we're seeing it every day, we can kind of become numb to it. Because we're with our colleagues all the time, we just assume that because I'm with you all the time, you're counted as my inner circle. But the reality is that we're not. We all go into different places. So you do want to be safe, even within your hospital, to have that social distance. Don't just gather together because we're working together. Even though you're forced to be in the same place, you still want to be safe and maintain that distance. Until we have a vaccine and we have immunity, the best advice is really just to stay home. You want to stay at home. Reason being, when you're at home, you're not exposed to the virus. If it is that you do have to go outside, we do advise that you be socially distant. And what that means is you want to have a minimum of 6 foot distance between you and another person that you're not usually in close contact with. When it is that 6 feet distance cannot be maintained, you want to at least wear a face covering where your nose and your mouth is covered. So that would be one. The other thing is hand hygiene. You want to make sure that you wash your hands as often as possible with soap and water for a minimum of 20 seconds. And if it is that you don't have soap and water, you want to have hand sanitizer, so at least you can clean your hands. And you want to have at least a minimum of 60% alcohol in the hand sanitizer. Because I work with children, a lot of people ask about children and face masks, and the guidelines are that children should wear face masks. However, kids less than the age of 2, we don't necessarily recommend it. And if your child cannot easily take off a face mask, it's not something that you want to put it on so that they're trapped and they can't get out of it. I would definitely recommend for parents that at home practice wearing a face mask with your child so that it's not a foreign concept and they get used to it. Like, you can put it on your stuffed toys, put it on things that are non-threatening, so that the thought of wearing a face mask isn't scary and intimidating, but it's something that's welcome and they're used to. You also want to start getting into the habit of wearing it at home so that you can kind of train them not to touch their face when they have on their face mask, because kids are going to want to touch everything. And if you could at least kind of train them at home in a safe place, then when they go out, it would kind of reduce their risk. Not eliminate it, but reduce it. So in regards to going to playgrounds, it depends. It depends on your state and what your local authorities say. So first of all, if the local authorities say that the parks are closed, then the parks are closed. I won't recommend going to playgrounds only because it's not necessarily cleaned all the time and children spread germs and they lick everything. So it's probably not the safest thing. However, if it is that within your state or your territory, the numbers of the incidents are low and your state officials said that it is safe, I would still want to know in terms of cleaning regimen, look and see how many people are using the park. I was actually just reading the AAP guidelines and they were recommending that you don't want to go to far parks. You want to just stay somewhere in your neighborhood. But definitely right now, I think where things are so uncertain, I probably would recommend it. With regards to summer camps, because I know that's something that a lot of people are considering. And for the most part, with regards to the official guidelines by the AAP, they do think it potentially could be safe, but you definitely want to be asking the right questions. What is the camp to child ratio? What is their policies that are in place? Do they have policies that are in place? Can social distancing be enforced? How large would the classroom setting be? Would there be sharing of any sort of utensils or anything like that? And what is their policy with regards to ensuring that patients aren't sick before they come in? Like, are they doing temperature checks and stuff like that? So you definitely want to see what it is that that camp is doing in terms of safety and make sure that it actually meets guidelines. Other things to consider, swimming pools. So especially with the summer, a lot of people are going out to swimming pools, and effectively, we don't think that the virus can be spread through pools, especially since most pools are disinfected with bleach. But again, if you go to the swimming pool and it's completely crowded and you can't maintain social distance, then it's not the safest thing. So if it is that you have a pool if you have access to a pool that nobody else is in at that moment of time, then it's safe. And again, the safest thing is if it is that you or your child is sick, you definitely want to stay home, because even if it is that that child may not have coronavirus and may just have like a regular virus, you still don't know and you don't really want to spread germs. So once you're unwell, you shouldn't really be going anywhere at all. The thing that everybody would want now is a vaccine, because the reality is COVID-19, the virus is here with us. And because it's reached a pandemic level, it's almost near impossible to eradicate the virus. So the best bet we have against it is to have immunity from it. And the only way we can guarantee adequate immunity from the virus is to have a safe and effective vaccine that can protect us from getting it. So that's where I would put all my dollars right now in terms of research, because that's what we need, because that's really the only thing that can protect us going forward. We could also look into possible treatment options. There are many things that we're trying, and there are lots of trials going on to see what can be done to mitigate it once you do have the virus. So we want to have a safe and effective treatment protocol, because now there are lots of trials and we don't have anything quite standardized yet. So coming up with something that is show and proven that this is what you're going to get and this is what's going to cure it, that would also be really good. Thankfully, at my institution, we do have adequate personal protective equipment. Initially, when this pandemic started, there was scarcity and things were pretty scary. And it was also confounded by the fact that there was panic. A lot of us didn't know how much resources we had and if it would last, and that was kind of driving things into chaos. But thankfully, we do have enough protective personal equipment. However, I do know that there's some places that doesn't have enough for their healthcare workers, and some healthcare workers are working with bare minimum. With regards to us as work, what we use to protect ourselves is we use an N95 face mask, which protects us from the airborne particles of COVID-19. And then you cover your eyes with either goggles or a face shield, because really what you want to do is prevent the virus from getting into your mucous membranes, which would be your eyes, your nose, and your mouth. So you want to make sure those things are covered. And you want to make sure that the air that you're inhaling is filtered, which is the purpose of the N95. We also, in the hospital, apart from whenever we're going to see a patient who's known to be infected with COVID-19, we put on all of that. But generally, just for our everyday use around the hospital, we are required to wear face masks. Because what we know is that COVID-19 is spread mostly via droplets, and face masks do protect you some degree from getting it, or worse yet, spreading it. So for us, all of us health professionals in the hospital all the time, every day, we wear face masks. it is advised that the public should wear face masks. And for the most part, people in South Florida have been adhering to the rules. However, since they've started reopening, we've seen images of people on the beach not wearing their face mask. We've seen reports of people going out to restaurants and not wearing their face mask. And we know that's not good, because ideally the best way to protect yourself is to be socially distant. And if you can't be socially distant, you want to make sure that at least you're not spreading the virus out there if you happen to be asymptomatic, which is why you want to wear a face mask.